Hey everyone, let's talk about something important. Atrial fibrillation, or AF. It's a heart problem where your heart beats funny, like it's skipping a beat or racing, and this can cause big problems like a stroke. Lots of people have AF, and many don't even know it. It's like a silent problem, so regular checkups are super important, especially if you're at risk. Finding it early can really make a difference. If you have AF, you need to take care of it to avoid those scary problems. Taking your medicine is really important. Knowing about AF is the first step. Getting diagnosed early and taking the right medicine are key to staying healthy. Let's talk about medicine for AF. Blood thinners are super important for many people with AF. They stop blood clots from forming in your heart. These clots can travel to your brain and cause a stroke. There are different kinds of blood thinners, and your doctor will choose the best one for you. It's important to see your doctor regularly to make sure the medicine is working and safe. Blood thinners work great, but they can sometimes cause bleeding. If you're on blood thinners, watch out for any signs of bleeding and tell your doctor right away if you see any. Even though there's a risk of bleeding, blood thinners are really important for most people with AF to prevent strokes. Taking your medicine exactly as your doctor says is key to staying healthy. Talking to your doctor regularly is really important for managing your AF. To see how people in Nepal are dealing with AF, a study was done at a big hospital. They wanted to see what people with AF knew about it and if they were taking their medicine, especially blood thinners. The study looked at lots of people with AF. They looked at how old they were, whether they were men or women, how much education they had, and how much money they made. This helped them understand what affects how people manage AF in Nepal. They asked people questions about what they knew about AF and how important blood thinners are. The researchers looked at all the answers to understand how AF is being managed in Nepal. This study showed us what's working and what's not when it comes to taking care of AF in Nepal. Knowing about the different types of people with AF in Nepal really helped the study. The study showed that many people in Nepal don't know much about AF. They didn't know how serious it can be. Because of this, many weren't taking their medicine like they should. This means we need to teach people in Nepal more about AF. It's really important that people understand what AF is, what can happen if they don't take care of it, and why taking their medicine is so important. We can do this by having doctors talk to their patients, giving people information to read, and having programs in the community. When people understand their health problem and why treatment is important, they're more likely to take their medicine the right way. This study shows that doctors, the government, and patient groups in Nepal need to work together. If we all work together, we can teach people about AF, help them learn more, and make sure fewer people in Nepal have problems from this heart condition. And